Hello, everyone. I'm Whitney Ortiz, host of the Whole Health series and founder of Whole Health Self-Care. I'm thrilled Dr. Ruth Moore is here to share with us. Dr. Moore is a Native American who joins us from Maine. She is a board-certified clinical aromatherapist with 30 years experience and is an integrative practitioner who practices spiritual psychology and specializes in both behavioral and holistic health. She completed her graduate work in cognitive neuroscience and behaviorism, and then earned a theological doctorate that focused on spiritual psychology. Presently, she's completing her second doctorate in mind-body medicine, Psychoneuroimmunology, while she works in private practice. Her passion lies with supporting veterans who have diagnoses of PTSD or other mental health conditions. In 2014, she founded INTERNITY, which is a 501c3 nonprofit organization that advocates for, assists, educates, and empowers veterans in their communities. Thank you for sharing your guidance and story here, Ruth.
Thank you for such a wonderful introduction, Whitney. I don't know if I can live up to it.
No, you have, and your experience and expertise is so vast. Where to begin is the biggest challenge for me here. But let's begin with a focus on how and why you gained an appreciation for whole health, integrative medicine, and integrated care. Can you please briefly share on your personal transformations that have informed your career trajectory?
Absolutely. So I started in an entirely different career field many years ago when I was released from the Navy after suffering trauma and developing a disability. I couldn't get help, and that was really difficult. And I struggled for 27 years to get the help that I needed. And so that included a mixture of different therapies from the Veterans Administration, and they missed so many things that could have made a difference in my life now. Um, and aside from me, I also have a beautiful 19-year-old daughter who, when she was 11, was diagnosed with not one, but two congenital heart defects. And that meant that she couldn't take a lot of medications that young ladies needed to take for cramps and headaches and colds and things like that. And I knew there had to be something better. I wasn't getting supported with the American medical community. And so I went back to my European training, which had been 30 years before, in clinical aromatherapy. And I realized it's like, why? So I went ahead and looked in at all the training that I had and the pharmacology that's available in nature. Then I literally had the Native American dream walk that says, you can make the difference. You know, the creator gave you these plants, use the power of the plants to create a practice. So that's what got me into it. And then I found out there's a school that teaches about complementary health and medicine, which is fully accredited in the US. And I entered my second doctoral program in 2017. And I'm actually pleased to state that I'm actually getting ready to enter my doctoral proposal stage, which is one class, and then I'm working on my final dissertation. So it's like, yes.
Yes, that is tremendous. And with all that you balance every day in bringing forth your knowledge and your own personal experiences in service to others, it's just very inspiring. What do you believe is the way forward in medicine and in our healthcare system as a whole to support our whole health and well-being? And what do you feel that today's women should really be asking of their healthcare providers, insurance systems, et cetera, based on your own personal experience and what you've learned through your different studies and practical applications with in your
That
practice?
is a loaded question.
Yeah, there's so many things to get through because of your experience.
Oh, so let me just kind of give the nickel version that back in 1911, we had complementary healthcare. We had natural healthcare. And this little guy named Rockefeller, and Vanderbilt, they said, oh, wait a minute here, we're not making enough money, so we need to regulate the medical industry, and we should only have physicians come from this one college. And if you don't come from this one college, then you're not a physician. And they created legislation back in 1911, and they also created the American Medical Association, which literally put a lid on all complementary and alternative styles. And Native American medicine was just completely wiped off the table because we were witch doctors. So back in the 70s, we started seeing a resurgence of complementary practices when nurses began to use essential oils for terminal patients or to help patients relax in hospitals. And then we started seeing more and more information come forward about complementary medical practices and then alternative medical practices. And what we're seeing now is the entire field shifting. So it's not complementary and alternative medicine, it's complementary and alternative and integrative medicine. And this is where I'm specializing. Integrative medicine is where you're taking the best of complementary and you're working with allopathic providers and you're bringing the two together. And a good example of that is when we have a patient who's referred to us by physicians who say, this patient can't take antibiotics. They have allergies. What do we do? And then we look and we say, okay, well, let's look at the patient, let's look at the infections, and let's look at what we have going on, because we have different levels of essential oils and different herbs and different botanicals that have antibacterial and antibiotic properties in them. So the second part of your question is, how can we reframe that for women? We know our bodies. Women know we know our bodies intimately. We know our children's bodies. We know our spouses' bodies. We need to follow our gut instincts and we need to advocate. And the one question is, I understand what you're telling me for this type of medicine. What holistic options do I have? What natural options do I have? And an example is when I was 17, going on 18, I was in boot camp in the military and I was diagnosed with cervical cancer. And I was given a direct order by my physician that said I had to go through a complete hysterectomy and I had to, have all of my female parts removed. And the native in me came out and I said, I understand you're giving me a direct order, sir, but can you delay that order by 60 days and let me try to do some things that, my foremothers have done? And he said, I can give you 60 days and I can transfer you up to your next command, but you might be medically discharged if it's not effective. So I self-treated and I actually cured myself of cervical cancer when I was 17 going on 18. Mm-hmm. And I've been able to help young mothers do that. I had a young mother in Maine who had 5 children, and she is in her mid to late 30s, and she was diagnosed with cervical cancer. And I basically gave her a lot of information. I said, this is, these are the resources you want to look at. These are some of the things you want to try. You have to clear this with your doctor. But if your doctor is willing to give you this time delay, I can help and guide you on these, choices. But you have to do the work. I can't do it for you because I'm not a physician. Doctor, yes, not physician. And she did. And her doctor actually got very irritated with me and reported me for practicing medicine without a license, because all of a sudden she didn't need chemotherapy. She didn't need cryosurgery. She didn't need, multi-million dollars worth of treatments, because she cured herself. And so I was obviously exonerated from that because I just took an advisory role. But the fact is, we as women have to realize that the medical industry is not out there to cure us. They're not our friends. They get paid to keep us sick. So and that's a horrible quote, so don't you dare use it everywhere. But literally, the medical industry thrives on illness, and the complementary and integrative medical industry thrives on wellness and proactive health. So we believe that people should be empowered to choose their own medical pathway.
Mm-hmm. Do you have hope yourself in this time of great transitions that are happening throughout all different industries, and looking at the healthcare one in and of itself, and at this time of the pandemic? where there are physicians, thankfully, out there who actively practice and advocate for functional medicine, integrative medicine, whole health approaches to care. However, it's such a big hill to climb with pushing boulders all the time. And you've been in Congress, you've passed laws. Can you talk to that about how we need to really be stepping up as leaders in any way we have a role to play with whatever hat we wear?
Yeah. So that's a two-parter as well. With the complementary and the allopathic medical industry, we're looking at the idea that a whole generation of physicians from 1911 to the 60s are retired out or are retiring out. Unfortunately, they still teach in a lot of medical colleges, so they still adopt the idea that complementary medicine is not there. They do offer complementary medicine electives for physician training, but the American Medical Association says that if you follow these practices, unless you have peer-reviewed evidence, we can yank your membership or we can sanction you for practicing, medicine that is not what you've been taught. Thankfully, the new providers that are coming into the field are more data driven and more scientifically based. So they are starting to conduct studies. They are starting to look at the industry standards and they're starting to realize, hence, the integrative approach is a very effective approach. With, the nightmare of the insurance industry and the quotas per day, they have to see so many patients in order to make their bills every day. They don't have time to specialize in integrative medicine or complementary modalities. So they're starting to realize they need help and they're starting to work more with integrative practitioners who have the appropriate credentials. For me, I have a postdoctoral certificate in integrative medicine that allows me the credibility to share what I know. And then when you add in the board certification for clinical aromatherapy, that's about 10 steps higher than someone who sells essential oils. Literally, we work with the chemistry of the oils and we work and make recommendations to physicians about how to use the oils in a pharmaceutical manner. So that's the first half of the equation. The second half of the equation is we are women and women are doers. Men like to fix things, but women are the doers. We are the people behind the scenes. Hence why so many Native tribes are matrilineal, where the women run the show. But the idea is we have the empowerment and we have the internal strength and fortitude to stand up for what we believe in. And when it is for someone that we love, we are not going to stop. We become the mama bears that will literally do what we have to do. For me, I testified in Congress for survivors of military sexual trauma. And my story is rather long, so let's just suffice to say that I went for 27 years without help. I ended up going through a divorce, physical abuse, and was homeless before I actually testified and found my voice. And then I became, as one of my former friends said, a lightning rod to the United States. And I've been able to help connect veterans, both male and female, who have endured these traumas with the help that they need. And a quick, very quick example is the VA. The VA literally said that people who have endured military sexual trauma can get psychiatric help. But the people who've had these traumas, they've also developed physical injuries, migraine headaches, neck injuries, jaw injuries. Corey Choka is a great example of a jaw injury. And in my former professions, when I was struggling to build myself, I was in the dental field. And when I looked at dental x-rays, it dawned on me, it's like, wait a minute here, a dental x-ray shows damage to the mandible. It shows damage to the cervical spine. It shows this damage, and you can predict this damage by looking at the bone density and seeing that some of these injuries are over 20 years old. And I wrote a white paper and I sent it to the VA, and Secretary McDonald said, oh, wow, holy crap. And he invited me into DC and we talked about it. And if the military or the VA compares a military recruit's entrance x-rays to x-rays now, which they can take, they can see the damage, and there is the physical proof that they sustained this injury and they should be getting the medical help as well as the psychiatric help. And so Secretary McDonald changed the mandates in the VA so that VA facilities, if a person, alleges they have this and they ask for the medical x-rays or the dental x-rays to be compared to their recruit x-rays, they can find the damage and get compensation as well as medical care. It's a little thing that no one else thought of. And this is the power of a woman. If we're that determined, we can find it and we can advocate for it.
Taking a moment to just hold the space for the tremendous impact you and your work have had for thousands of people, and that ripple effect will continue into the decades to come. So on behalf of so many, I just thank you so much, and for sharing your work here. How can people get direct support from you in your current practice and the plans that you have moving forward?
Well, we started a nonprofit in 2014 when I finished my settlement with the VA and I won my very long, very backdated case. So we started the nonprofit. It's called INTERNITY, and it can be seen at internityonline.org. But we do a lot. We believe in empowering our clients. So we don't do the work for them, but we empower them to do it. And we have the connections. So if they need an attorney or they need, to have a letter written or they need something, excuse me, we help them do that. In my practice, it's www.downeastwellness.com. And there are many different modalities that we practice, and we have a functional nutritionist on staff as well. So we have the power and the drive of functional medicine, which is another area that a lot of people are not aware of. Functional medicine saved my life. Right now, you see me at 128 pounds. 9 months ago, I weighed 220 pounds. And so by looking at my health and looking at what the VA missed when I kept asking them for help, we found out that the VA, instead of giving me the help I need and telling me I was fat going to the MOVE program, they went ahead and ignored the fact that I had a gluten intolerance. And so functional medicine found that. And when I changed my diet, we also found out through DNA studies and hair strand studies that my body can't process protein or can't process grains. I can't produce the enzyme needed to process grains. So when I literally applied that knowledge with my brother's help, we found that my body was constantly inflamed, seizures, migraines, weight gain, chronic pain. It all went away. And so from just changing my diet, no medicines, no anything, but just changing my diet and developing a 5:30 in the morning workout. So I do functional medicine, and my brother, who is also a colleague in another office, he has a website. And so that is it's NeuroDoc for you. And so when we look at these things, we realize that we can empower veterans to take control of their lives. We can empower mamas to take control of their children's lives, because that's how we found out my daughter had, the cardiac issues as being the mama bear. It's really just, we need to be proactive and stand up for what we are. So with my organizations, I vowed to make a difference. And, hopefully someday when I go to my grave, I'm not going to go peacefully. I'm going to skid in sideways and the devil's going to say, oh man, look at that. But the idea is, I will never doubt whether I made a difference in my life. I think that I'm doing it, and it feels good to be able to help other people reach that point where they have that freedom to choose their medical care and advocate for themselves.
Yes, thank you so much, Dr. Ruth Moore. It has been an honor, a privilege, a pleasure to talk here with you. You bring up so many important points about how we need to question, to challenge that which we are given as quote unquote truth from traditional doctors and medicine, and really look beyond and to listen to our own selves, really tune in to know the importance of this whole health, functional, integrative approach to care. Thank you for embodying and sharing your wisdom, your experiences, and service to others. Thank you so much for being here.
Oh, you're welcome.